Good morning. Good morning. It is Dr. Murphy with Murphy Medical Associates and our team here at coronatestct.com. Today is February 15th, 2021. Hopefully I've fixed the microphone situation and hopefully I've fixed the camera too. One thing I definitely fixed was my hair. So, today we're going to talk a little bit, it's February 15th, 2021. We're going to talk a little bit about some new news that came out today from one of the labs in Massachusetts showing how vaccinated patients, their sera fails to effectively neutralize the South African variant. So we're going to go over that a little bit today. I wanted to talk today about vitamin D and how awesome it was, but I think I'll record that in a separate video that I'll post on the YouTube channel. Something I'll post on the YouTube channel itself. I'm going to test out my skills here, but right now I'm going to take a break from the field so I can give you Murphy's Medical Minute. Now I'm also live streaming on Periscope as well as YouTube, so if you have questions you can hit me up on either of those. I'll watch and see what's going on. But right now, you just need to know, you found the Murphy Medical Minute. Welcome aboard. All right, guys, so some important news dropped today. That I want to talk to you a little bit about. We have found vaccine escape, right? One of the things that we found in the past was that the AstraZeneca vaccine, that's a vaccine that was designed as an mRNA vector vaccine to prevent the novel coronavirus, was not effective at all in South Africa. It was not effective for the South African variant. Well, what's the South African variant? Well, here, I'll be quick. I'll tell you guys what the South African variant is. You can take a look. So the South African variant is called B1351. B1351, and currently we are testing all of our patients that are positive for the South African variant. We have found the first cases of the UK variant in Westchester and also Fairfield County. We also helped contribute to the New Haven identification of this variant. The UK variant, not the South African variant, the UK variant now has data really indicating that it has a higher infectivity rate, so it's more likely to be infective, between 30 to 50% more likely, but it is also now new data showing with the UK variant that it is more likely, I repeat, more likely to make you sick. We have data on that now. We are getting data on the South African variant, and one of the big things we noted with the South Africa variant was that there was minimal protection, if anything, with the AstraZeneca vaccine against the South African variant. And what we found out with that is significant. What we found out with it was significant. We have a trial that has halted in South Africa because lack of protection. Now, why this is important, and I'm going to show you in the next slide, is that we now know the AstraZeneca vaccine does not effectively protect against the South Africa variant. We have solid data. One of the things I like to do on Murphy Medical Minute here, on the Murphy Medical Minute, is really not hype stuff. I try and tell everyone CTFO, right? Chill the F out. We have to relax and let the data roll in. But when there is hot data that is going to affect how we care for patients and our view of vaccines, we need to update you. And so on this minute, I'm dedicated to update you on some new science that just dropped. Obviously, it's important you know the caveats. Science has to be peer-reviewed. Science has to be replicated. Where science, multiple science, or sciences, meet healing is in the space where we have replicated data. First, I want to give you some very important caveats of what I'm going to present to you right now. Right now, I'm going to present to you data from a lab in Massachusetts. We now know the South African variant escapes AstraZeneca vaccination, right? We know it escapes AstraZeneca vaccination. Right now, the data I'm going to show you is part two for my guys down here, right? My Periscope guys, part 2. And that is a laboratory isolated serum of a patient, well, multiple patients who had been vaccinated. So these patients had been vaccinated, okay? Which means they've received 1 dose or 2 doses of the vaccine. Then their sera, their blood, was spun down to identify the antibodies, right? To identify the antibodies that were made in the sera. So those antibodies, that blood, was then used in a laboratory to try to neutralize different variants of the virus. So I hope you understand what I'm saying here, so you guys have a good idea. If a patient is vaccinated, their blood should be able, their sera with antibodies in it should be able to neutralize novel coronavirus. After all, that's what the vaccine is for. I just showed you data where the vaccine was ineffective with AstraZeneca. The AstraZeneca vaccine was ineffective with the South African variant, where the South African variant was not neutralized, right? The South African variant was not neutralized using the AstraZeneca vaccine. It was not protective at all. So here, I'm going to move you guys over here while we're talking this way. So it's not effective at all. Happy President's Day. George wouldn't want the AstraZeneca vaccine, right? All right, so I got a little comments from my peanut gallery, the people I love that have had me forever, the Periscope crew. So yeah, the AstraZeneca vaccine is suboptimal for the South African variant. Now we have multiple variants tested for. The South African variants are called B1351. The Brazilian variants are called P1 and P2, right? These are Brazilian Japanese variants. And then we have the UK variant that everyone was all freaked out about. And we were really, I'm so proud of what we did, right? Today I can tell you we detected the first cases of the UK variant in Fairfield County and in Westchester County. We found them working with Yale and with a fantastic lab, right? The Grubau lab has been amazing. Just an amazing lab. He's a great scientist, and I've been so happy with that laboratory. So now I want to talk about these laboratory findings, which are just now put up on medRxiv. This is cutting data for you guys. I want you to take a look at it. So can you see the slide okay? I hope you can see the slide okay, right? You're not going to be able to see my cursor, but I want to show you and explain this slide. In this slide right there, right? Oh, right there, right? The slide right there. In that slide right there, we have people who received 1 dose and 2 doses of the vaccine. 1 dose and 2 doses. We know at 2 doses, 14 days out, you should be protected. You should be protected. And that is why the CDC changed the quarantine guidelines if you've had 2 doses of the vaccine. If you had 2 doses of the vaccine, you can quarantine. Yeah, I mean, you can skip quarantine if you're exposed to a patient with COVID. If you're exposed to a patient with COVID. This data right here, right? This data right there, that data, I'm telling you, right there, that data right there gives me reason to pause that quarantine, right? We found the South African variant. The South African variant is in the United States. it's in the United States. The UK variant is in the United States. Here's what the study found. Patients who received the PFIZER vaccine, not the AstraZeneca vaccine, the PFIZER vaccine. Patients who received the PFIZER vaccine, right? These patients had their blood drawn. Their sera was isolated. What is sera? It is a spin down that allows you to identify antibodies, right? It allows you to identify antibodies, right? These things that try and bind the spike protein, right? We're going to bind that protein. Keep it from binding in our cells. So we're going to try to bind the spike protein with that sera. And it should do a good job. It should neutralize the virus. And so you can see on this chart over here, right? I don't know if you can see it. Yeah, behind the microphone. So take a look, right? Was it where the mic is? So take a look. Take a look at that chart. Now, naturally, with one dose of the vaccine, right? One dose of the vaccine, we have a lower neutralization capacity, which reminds everyone, if you got the PFIZER vaccine, you need 2 doses. You need 2 doses. You need 2 doses of the PFIZER vaccine. Not 1 dose. 1 dose? No. 2 doses. You need 2 doses of that vaccine. This chart should highlight exactly why. Right? 2 doses of that vaccine are needed to achieve neutralization of these variants. And what we found is simple. The wild type, or the D614G, that became rampant in the United States with our first waves, is effectively neutralized with the PFIZER vaccine. Effectively neutralized with the PFIZER vaccine. All right? Effectively neutralized with the PFIZER vaccine. The United Kingdom variant, B117, is also effectively neutralized with the PFIZER vaccine, according to this study that is pushed on bioRxiv today. The Denmark variant, also known as the Mink variant, B11298, is also neutralized with the PFIZER vaccine. That virus is also neutralized with the PFIZER vaccine at 2 doses. 2, not 1, 2. 2 doses of the PFIZER vaccine work on the Denmark variant. One of the new United States variants, B1429, also is neutralized with the PFIZER vaccine at 2 doses. Not 1 dose, 2 doses. You have to have 2 doses. That's the next part, is where it gets kind of scary. In the Brazilian Manaus variant P1 and the Brazilian Japanese variant P2, we see a reduction in neutralization. A significant reduction in neutralization has happened. A reduction in neutralization has happened. Okay? That means the PFIZER vaccine given in 2 doses given to patients, resulted in a serum from the blood from those patients isolated with a greatly reduced neutralization. Less effective neutralization of the Brazilian Manaus variant and the Japanese and Brazilian P2 variant. With 2 doses, we had a reduction in neutralization. Reduction in neutralization. That's significant. I don't know if everyone's getting an understanding of this, but I'm going to put it in layman's terms. We're probably going to need a variant alteration of this vaccine every year. Very similar to influenza. And if you look at the words from the CEO of Johnson & Johnson, they basically indicated this. We're going to need, I know, I love Eastern Connecticut. I love it. I wonder, and I'll tell you, I wonder this. Sorry, so for my people on the YouTube, I'm going to tell you that my people on the Periscope have asked the question, when are you coming out to Eastern Connecticut? So if you guys know anything about Murphy Medical Associates and our team at coronatestct.com, that's coronatestct.com, we are located in New Haven County, Connecticut. We are located in Fairfield County, Connecticut. Linda, one of our big viewers, is located in Hartford and is pushing for us. We're negotiating to come into Hartford County, Connecticut. We are working hard on getting our vaccine distribution set up because we've been approved by Connecticut, CT, to give vaccines, and we'll give them out probably in a couple of weeks. And this is important data. This is why I'm presenting this data. We are also in Kings County, New York. We are in Manhattan, where we're deploying, I don't know if you guys on Periscope may have caught it, but I don't think anyone on YouTube caught it. We have a portable MRI machine service, right? We have a portable MRI machine service where we can deploy portable MRI. It's amazing. Through a team called Hyperfine, which is also located in Connecticut, starting to move on the eastern side. So Coastal Ben Byrne asked me a question. When are you coming to Eastern Connecticut? When are we coming to Eastern Connecticut? We're going to have to work on that very soon. We're going to have to work on it very soon. We just have to find office space, right? The key is finding office space in Eastern Connecticut. We know that New Haven is in Eastern Connecticut. We know that that's right on the line there, right? So the end of New Haven County, Guilford and that sort of area, that's where the Hyperfine came from. But I'm talking even further out. I was a naval midshipman, and because I failed the flight physical, I was going to have to go to Groton, Connecticut, right, to do boomer training, right? New London, baby, Groton. See, we nailed it. I was going to have to go to Groton, but instead, I left the Navy and went to medical school. Oh, all right, fair enough, right? It's a very complicated situation on the eastern coast of Connecticut, right? Eastern coast of Connecticut. One of the testing that we did with our, sorry about this diatribe and scale off, but we're talking about a Periscope. So we had tested the team at Lockheed Martin and Sikorsky at our Stratford site for a long time. So we're used to working with governmental contractors in the military. We do it all the time. So the answer is we have to find a home in Eastern Connecticut that'll want to test, treat, isolate, and trace with us, right? We test, we treat, we isolate, we trace. And one of the important things we test is for the variant. So yeah, I'm going to bring it back around to the variant now. Here's the issue. The South African variant is in the United States. And if we open up travel all over like we're doing, and when we choose wealth over health, right? Wealth over health, we choose wealth over health, we have a problem, right? We have a problem. And we really can't choose wealth over health here. But we are. And that's going to haunt us. It's going to haunt us here. Because we're going to get an increase in the South African variant. People are going to walk around thinking they're protected with the PFIZER vaccine. Why? I think we just demonstrated it. And this data here are essential. The PFIZER vaccine protects against the UK variant, B.1.1.7. The PFIZER vaccine protects against the wild type variant and the variant that took over the United States in the first wave, D614G. The PFIZER vaccine protects against a newer American variant, B.1.4.2.9, and against the mink variant, B.1.1.2.9.8. The PFIZER vaccine shows lackluster protection against the Manaus variant, the Brazilian variant, P1, which we found in Minnesota, we found in South Carolina. We're going to find it in a lot of places. But more importantly, we need to prepare for the fact that there is something in the Brazilian variant and there is something in the South African variant that gives it evolutionary fitness. We are seeing convergent evolution happen before our eyes. Before our eyes. With a rapid spread of a virus that is infecting a lot of people, that is an RNA virus that enables easier mutation of its receptor binding domain, right, the fist, and its arm, the N-terminal domain. We are seeing mutations. Those mutations are conferring an evolutionary fitness. That evolutionary fitness is converging with more problems. It's more problems. So I really want to bring these points up for you guys. Vaccination is only going to do so much. This new data off the presses, right, that is going into medRxiv today, indicates that the Pfizer vaccine does not induce a sera that protects effectively against the South African variant. This data will need to be replicated. We need to do further study, but it's a significant finding. It is not peer-reviewed. So again, at the Murphy Medical Minute, we say CTFO. CTFO. Chill the F out. Let's get more data. Let's get more data. The reason why we need more data is, put simply, 1 in 3 Americans do not want to get a COVID-19 vaccine. We will never, ever achieve herd immunity if we don't get these vaccines in. Right. We also need to know that there are certain limitations in the vaccines that we have. I just demonstrated the escape with the AstraZeneca vaccine and the preliminary data showing escape with the Pfizer vaccine with the South African variant. We also have news coming from the New York Times about rare instances of the vaccine triggering autoimmune effects. Sorry, a little tickle in the throat. COVID negative. A little cough, a little tickle. About 1 in 3 Americans say that they're not going to get the vaccine, and I think there's a lot of reason for this. I think one of the reasons is, in the news, we're highlighting cases like Luce here, right? We've got Luce right here who got ITP, an autoimmune attack from the virus. Autoimmune attack from the virus. That is rare. Not as rare as anaphylaxis, but still pretty rare. It's pretty rare. But we have people very concerned about the immunologic triggers that come with vaccines. That's from decades, right? Whether it's the fake data on the mercury stuff or the true data on ascending paralysis with the influenza vaccine, it's obvious that vaccines trigger our immune system. That's what they're designed to do. With 1 in 3 Americans not wanting to take the vaccines, we're going to have a hard time here. We're going to have a hard time here. This data showing Pfizer escape is significant. I want more data. I want more data to really understand. But perhaps this is variant escape part 2. We have a whole bunch of people that have now been vaccinated with the Pfizer vaccination. Will they be overconfident with their vaccination? Will they let up masking? Will they let up social distancing? I don't know. I don't know. We have to be very, very careful with it. So I open the floor again for a little bit of questions. If the Periscope team has questions, the YouTube team has questions, anyone can take a look in and ask some questions, right? We'll open it up, see what we got. See what we got, take a couple of questions. Welcome, right? It's the Murphy Medical Minute. We're brand new here. We're continuing to grow and develop and highlight. Right now, I'm highlighting the fact that we have variant escape of the South African variant and probably the Brazilian Manaus variant from the PFIZER vaccine. This data is going to need to be replicated. We need to be replicated. Preliminary data posted to medRxiv today. Posted to medRxiv today. So I really hope that everyone understands a couple of things. So I'm gonna wrap up a little bit here, just talking to everyone really about some important points. Whew. Interesting data today. I really wanted to talk about the vitamin D study, which, F. Perry Wilson highlight that there are some suspect statistical analyses going on with that study in Spain. And I think it's important that we know there are going to be limitations on data. There have always been limitations on data. Imagine how we had to operate in March, April, and May with minimal data. We had Chinese data coming in. Some of it was restricted. We didn't get access to it. Most of those things weren't posted on medRxiv. We had a lot of people working very hard in January and February trying to get some sort of understanding. We had the vaccine distributors working to develop a vaccine in January when they got the genetic code. They've done a fantastic job. It is anthropomorphic egotism if we believe that we can combat fully the forces of nature. We have had some big wins. Vaccinations are one of those wins. Antibiotics, another one of those wins. But we cannot get overconfident here. The data that I just presented to you are very preliminary. We will need replication of this data, but they should give us cause for concern. It is now clear that the South African variant is escaping vaccination protection from the AstraZeneca vaccine. That's crystal clear. We now have evidence that the PFIZER vaccine may not, this is preliminary evidence, may not produce sera, blood, right, part of the blood, in vaccinated patients with 2 doses. It may not be protective. So we have to be cautious. How are we going to be cautious? Well, I know what I'm going to do. I'm going to mask up. Now remember the teaching point I told you about these, right? You always want to, let's see if I had all focus on this here. Focus. You see that writing on there? NIOSH N95 writing. See that right there? All right. So it's very important that you look for the printing on your N95s if you're buying N95s. We have KN95s, right there, KN95s. The KN95s have been counterfeited. There are massive amounts of counterfeit KN95s. That's why you have to look for the lot numbers and the printing on their wrappers. On the regular N95s, they'll either be on the bottom of the N95, or they will be printed on the strap, like I just showed you. We also talked about regular surgical masks and how you can protect yourself by just looping the strap, or you see how to loop the strap? You can tuck in. You can even buy clamps to pinch these to form a tighter face seal. You see, you can buy a clamp to form a tighter face seal. So we need to focus on being able to do that. Also, can we take cloth 2-ply masks? Can we take 2-ply masks? This is one of my kids' masks, right? So I think I got it upside down. Right? Can we take a cloth mask and put another mask over it, right? I can't stretch these. I don't want to stretch a poor kid. I'll stretch your ears out. So can we double cloth mask? The CDC is saying maybe we can. The reason why they're saying these things is because they know that nature is stronger than us. Nature's stronger than us. We have some really cool tools to protect. We have data, new data with tocilizumab to help those that are critically ill. We have monoclonal antibodies. We have the FLCCC. We also have the AAPS advocating for treatment using a Math Plus protocol. We have data for ivermectin coming out, more data coming out. We are certain, and we'll go over it on a vitamin D video, we're pretty certain that vitamin D is going to help us. Even though there's hot data, there's no reason for anyone to be vitamin D deficient. Although a good friend and contemporary of mine sat on a couple research boards with me, Charles Rotimi, said, you know, maybe your Reuben Africans don't need that high level of vitamin D. Maybe not. But in the Northeast and in the United States, I don't think there's any reason whatsoever to be vitamin D deficient. So I think we should take vitamin D. I think we should take it. 2,000 to 5,000 international units. And this is coming from a guy who gave himself a kidney stone taking too much vitamin D. That's why we have to tune it in right, and it's why we have to check blood work. To recap, we're on 30 minutes. I'm going to cut off now. Put simply, we have new data showing that the PFIZER vaccine may not be protective for the South African variant and may not be protective for the Manaus Brazilian variant. It is preliminary data coming from an independent source, not from Pfizer itself, an independent source indicating that when a patient has received two doses of the PFIZER vaccine, their blood does not neutralize South African variant and does a less effective job of neutralizing the Brazilian variant. This is significant data that will need to be replicated. What does it tell me as a doctor taking care of the patients? Well, I'll tell you. So I can get a better view of you. Don't let up. We're not out of the woods yet. Variants are here. We need to test for them with a genomic surveillance system. Our team at Murphy Medical Associates and our testing process at coronatestct.com reflects tests positives for the variants. Many places do not do this. Many systems do not do this. And we've shown classically that genomic surveillance is woefully inadequate. In Connecticut, we are probably one of the best states with a decent percentage. California as well. The best states have high throughput genomic laboratories. Maine with Jack's Labs, and Washington, all the way across the country with UW in Seattle. They have great, robust sequencing. Most of the rest of the country does not. We won't know how bad the South African variant is in the United States until it grows. The same is true for the UK variant. The PFIZER vaccine is effective at neutralizing it, but not everyone has gotten vaccinated. And 1/3 of the United States doesn't want to get vaccinated. So we have a lot of work to do. mask up. This is Dr. Murphy, Murphy Medical Associates, and our team at coronatestct.com. You're watching the Murphy Medical Minute. Today is February 15th, 2021. Thanks for joining. Make sure, to my YouTube listeners, you hit the thumbs up. And make sure you subscribe, because I've got a lot of data. We're in the 7th inning now. We got a long game to play. I'm here for you. With